there, this is Bernie. I work with the respiratory department here in West Coast General Hospital along with my colleague Caitlin. We work 7 to 18:12 every day, 7 days a week, and we would be happy to help you with anything respiratory that is. Today we're going to talk about CPAPs. When a patient has a CPAP that they're on at home that is brought in by a family member, or if you find either Caitlin and I have set up a patient to trial out our CPAP before their discharge, and then to go further to get a CPAP in the community with a referral to a different company. You will find us bring in these things. We do have a CPAP here in our ICU that's available for people to utilize when they're here, or you might find that we've set them up from the ICU into the wards with the CPAP. It actually has everything that you need and it's fully set up so you can just grab the bag and go. Most of the times though, we should have this set up as the therapist because those kinds of requests will come to us to set up a patient with CPAP if they don't have one at home, or if they're going to be trialing this therapy before they leave. It's found that in the hospital as an incidental finding, they do need CPAP therapy. So, and we're taking them to the wards, and we need to support them with that. So in this, you'll have the hose, which is a single-use hose. You'll have an air connector or oxygen connector, which actually you may not use. In fact, mostly would not use, except for in special circumstances where they require CPAP and oxygen. Your power source, your CPAP device, and your humidifier. Okay, so when we come as respiratory therapists to set this up, we usually want a nice clear side table on one side of the room or the other, whichever way the patient usually rolls onto their side is best, so you're not having the hoses come over. First thing we would do is take the device out, set it up, plug it in. You must have room. You want to have the room available to set this piece up. You don't want it to be squished on a table. So you're just going to plug in the back here. There is a little plug-in for the machine to the power pack right there. And then from the power pack, this should already be attached and into a plug. So that will give it power. It will turn on because it's set up as on. We're going to put in the humidifier. So right now the humidifier is empty, and we will go further with that. Here is a brand new hose, which I'm just going to show you how we are going to connect. Rubber ends on both sides. In the back here, there is a port just to push that in. Now, if your patient required oxygen, you would know because Caitlin and I would discover this from a overnight oximetry that we had done. This piece would come out and then go in like that. And your oxygen tubing, your extension tubing, would then hook onto the back and then onto the wall. Usually it's only a couple of liters of oxygen that would be required in the device, because of course the CPAP, the support that it's giving, should help to overcome some of the hypoxemia or maintain the sats that we need them to be. When we plug this device in, it's already in the on position. So all you have to do is press that. You can see it's on. It is an automatic on and an automatic off. So I'm going to teach you a little later in the video how to make it more comfortable to apply the CPAP to the patient and to take it off without them getting big rushes of air. We will set the CPAP up the way it should be in the background, but you will have this as a screen to see. You have either a sleep report or options that you are able to do. As RTs, we will make sure that this is set up when the patient comes to you. Once you have this here, you need to figure out which mask you need. The masks that we have here, and again, Caitlin and I will set these patients up, are in the orange bag. If you ever go into the cupboard that has the CPAP available for patient use, you will find a few of these or a couple of each size in there. It works the same way as our other masks that we use for BiPAP when people are more acutely ill. In here, on the top of all of them, you actually have a sizing guide. The sizing guide actually doesn't sit like that, because when you sit like that, you are already in their eye space, and that will run into leaks. Where the line is actually supposed to line up to is the lower lash line. Once you have it in the lower lash line, and I can't see very well, you can see that my mask size should be small, and I've changed a whole different mask size from if I put it right there. So the best fit is to bring this down to the lower eye level, the lower lash, and then check in the divot between the lips and the chin, right in there. That should line up to the mask size that you require. Once you've figured that out, you grab the right mask and you apply it to the patient. I'm going to tell you a couple things about the mask situation. You don't want to have too large of a mask, because that will lead to leaks. So the better fitting mask is always going to be the best for the patient, so that we're not encompassing the whole face and things that we shouldn't be covering. Because I fit into a small mask, I'm just going to show you some of the things I would do if I was putting this on a patient and trying to set them up for success at night. You're going to start your mask like this, with the headgear on this side of your arm. So if you're looking at the patient, it will be like this. Okay? You're going to then place it in the divot and over the nose. Once it's in the divot and over the nose, wrap the headgear over. Oh shoot, hold on a minute. Headgear over the head. So again, in the divot. And you can see that the top is already a little too tight, so I'm going to loosen it off. And now I'm just going to tighten off these ones here. Make sure the clips are going to clip in properly, not twisted. Okay. And you want it snug, but not so snug that it makes a mark on the nose. So you may end up adjusting this a little bit. Once you have this adjusted and you trial it on the patient, and you don't find any leaks around the eyes or around the chin here, then you know you have a good size. I'm able to breathe on this mask because there is an open vent exhalation system to breathe out. So once I'm set up, once I've got this on my patient and it's all set up, I'm going to plug myself in. And you can see it has already started up.
Check for leaks. There's no leaks that you can feel around the eyes. Your patient will help you with that, or in the chin. Then you have the perfect fit, and you can see it's not super tight and bending down on the nose. You'll find there is an exhalation valve here, so you will feel air come through here, and you need that because that's where you're doing your exhalation of the air. Okay. So just as you put the device on, you're now going to take it off in the morning. Best way so the patient doesn't get a gush of air. Disconnect right here first. That will automatically stop, and then release the clips. Do not change the Velcros. Release both clips, and then the same way you put it on,
Bring it over and take it off. Okay, now this device will automatically stop blowing air in a few seconds. Because it is set to auto stop. So we'll just leave that there to stop. So you could see when I had that mask on, it was fitting in the divot between my mouth and my chin. And it wasn't in my eyes because it was measured at the lower lash line. There was no air coming out the top nor around here. It wasn't so tight that I had an indent in my nose or my cheeks bulging out over the straps. When people move, and this one's not going to turn off, but it does usually. When people turn though, the mask does move. It's natural that it does move. Not one mask won't move. And you may get a little leak, and then the client just has to just sort of readjust, and it should just be fine. For comfort's sake, I always put a mask on first. They can breathe through it, and then I add in the hose and the pressure. And the same thing that I do it in reverse when I want to take it off. I take the hose off and let it stop automatically, and then unclip. I don't move the Velcros, neither here nor here, because now they're set, and lift it over. These things over time don't last very long, and if you constantly pull at them, they will stretch and you won't have the right fit. The exhalation ports are right here. You can see with the little holes in there. You do have to have an area so you can blow out what you blow out so it clears the mask, and that is right here. So if you ever feel air from these ports here, that is okay, because that is your exhalation port. They're not building up their CO2s. To clean the mask, you must clean it every day, because even though we wash our face at night and we get the oils off, throughout the night our face will naturally secrete oils, and those will sit on the silicone mask, and it will affect the fit and the actual mask staying to the skin. So every day we want to give this a wash. You can hold it like this and just put it under running water with a little bit of soap in, just to wash off the facial oils. Rinse it, and then just ready it for drying. Just air dry it so that it's ready to use the next night. As I said, we have a humidifier. So the humidifier is going to be a passover because we don't have a heated hose. So it's just the air is going to flow by the sterile water we're going to put in here. And that will also need to be filled every day. There is a maximum mark. I usually grab one of these and put it in with the patient's room buy the CPAP machine, so they already have it. Once you've got it in, it just slips in there, and it provides a little bit of humidification of the flow that's coming through. In the morning, it is advisable to pull this out, empty the rest out, and then give it just a swish with soapy water and an air dry as well, so that we don't have little bits of water there ready to breed bacteria, mold, pink mold that can get in here if you don't clean it properly, which then goes to the patient. So both those pieces I would wash in the morning for the client, so that they can be assured of a good fit the next evening and have clean water being put in. When Caitlin and I are set the patient up, we usually will take the case out and bring it to our office, so we realize that there is a CPAP that is out on the floor and that we will have to get when the patient leaves the hospital. As you can see, it's very much marked that we do need to return it to the ICU. Once the patient is discharged, these are all disposable. Everything here is disposable, or if the patient wants to keep that mask, they can keep it. But once they go out to a vendor, the vendor is going to fit them for a different type of mask. This is one that they use in the hospital only. Everything comes apart, and you're just going to take it, you're going to call the respiratory, and we're going to take this, and what I do is send it to MD RD, and they give it a nice good clean, both the humidifier and the actual device, and then they deliver it back to the ICU, in which case we bring the case and we put it all back the way it was, including with the clean oxygen adapter, a new clean hose in a bag, the device, and when you next need it, it's all ready to go for the next patient. You will just have to choose which mask you want. There's a stash of at least 2 of each size up in that cupboard, and away you go. If you have to take this and we're not here, please leave a message on our phone or send us an email saying you set so-and-so up on this, so that we know where this CPAP is. They can go missing. I've seen them go missing from other hospitals and been found here, and I had to send it back to the originating hospital. So it can get confused. So the same procedure that you see me do here with our CPAP, setting up a patient, you would do the same thing with a person who brought in their own CPAP. Chances are the person with their own CPAP will have their mask already fit and know how to put it on and off, and you would have very little assistance, rather than just all you would have to do is set it up by their bedside, so there's a nice clear space, and give them a bottle of the sterile water. If you have any questions, give Caitlin or I a call, and we can go through this a little bit more with you. Thank you.